Many people who experience hearing loss turn to a hearing aids for help, but that's not always the answer. Here to tell us more is Dr. Jabbour and Dr. Alli Vollmer from Charlotte Eye, Ear, Nose, and Throat Associates. Both doctors, welcome to the show. How are you guys both doing?
Hi, good, thank you.
All right, for people who have profound hearing loss due to inner ear damage, all right, hearing aids may not help. Is that correct?
Yes, so with certain types and degrees of hearing loss, there's significant damage to the inner portions of the ear where patients no longer benefit from traditional hearing aids. And this is part of what makes a patient a candidate for a cochlear implant.
And so what can help is cochlear implants. So Dr. Jabbour, what are they?
A cochlear implant is basically a device that can help bypass those damaged portions of the hearing pathway and restore hearing to an ear that has too much hearing loss to benefit from a hearing aid.
So, Doc, I want you to tell us about the internal and external devices. Go ahead, Dr. Jabbour.
I'll talk about the internal device. The internal device basically has two parts. There's what we call a receiver stimulator, which is something that gets tucked under the skin and over the skull and helps receive the message from the external device. And then that signal gets transmitted through something called an electrode array, which is basically a short, thin cable that we insert into the inner ear. And that cable has a bunch of electrodes that then stimulate hearing at different frequencies. That signal then gets sent through the hearing nerve to the brain where it gets interpreted.
The external portion works, it's called a sound processor that sits on the outside of the head. It picks up sound through a microphone and transmits that sound to the internal portion through a magnet. The external portion is routinely programmed by the audiologist to enhance patients' communication as well as all of their listening experiences.
Okay, what is the implant procedure like?
So it involves basically making a small incision behind the ear and then working through that incision to create a pocket, as I said, under the skin and over the skull, where we put that receiver stimulator I mentioned earlier. Then you create a pathway through the bone behind the ear to the inner ear, the cochlea, which is where we make a small opening to pass the electrode array through.
Well, let's stay on the same subject. Can they be placed in one or both ears?
Yes, if a patient is a candidate for having them in both ears, they can certainly be placed in both at the same time. There may be surgeons who prefer to do only one at a time. And then, of course, there's a lot of patients who are only a candidate in one ear, and so they'll only get it in that ear.
So then that begs the question, who is a good candidate for cochlear implants?
So children as young as 9 months old up to elder adults who have hearing loss significant enough to impact their communication and who also don't benefit from hearing aids. They will be required to go through a formal evaluation that may include additional testing with the audiologist as well as a formal medical workup with the physician to make sure they're a good candidate for the cochlear implant.
And so what are some of the advancements in cochlear ear implants?
Well, at least on the internal device side, over the years, they've continued to try different lengths and materials and number of electrodes for that electrode array I spoke about. But the basic idea behind all those advances is to try to maximize the amount of hearing benefit while minimizing the amount of damage to the cochlea when it's inserted.
With the external processor, there are continuous advancements in the technology. For example, current devices are Bluetooth compatible, meaning they can stream audio and phone calls directly from patients' electronic devices up to the processor.
And what kind of results are you guys seeing from your patients?
So hearing with a cochlear implant is much different than normal hearing, and it can take time to learn and adapt to. With that, we look at several different factors when we consider outcomes for a patient, which includes when the hearing loss happened, what caused the hearing loss, the patient's age, as well as the patient or their family's motivation to succeed with a cochlear implant.
To learn more, call Charlotte Eye, Ear, Nose, and Throat Associates at 704-295-3000, at 704-295-3000, or visit WeJustMakeSense.com. Dr. Jabbour, Dr. Vollmer, thank you very, very much.